Welcome, everyone, and thank you for joining us for this learning collaborative of the Social Determinants of Health Academy, fostering a healthcare workforce able to address current and emerging needs. My name is Sabrina Edgington. I'm the Director of Learning and Curriculum Design at the Association of Clinicians for the Underserved, and I'll be moderating today's session. Just before we begin, I'd like to go over some housekeeping and talk a little bit about this Learning Collaborative series for those of you who weren't able to attend the first couple of sessions. This session is being recorded and it'll be available for you to share with your team or to view later. If you have any technical difficulties, please reach out to Danielle through the chat and she can help you navigate through WebEx through that chat feature. And so the series is centered around 4 core competencies for addressing social determinants of health. And those are increasing access to social determinants of health services, building a capable workforce, building capacity through partnerships and system delivery transformation, and understanding emerging issues that impact practice. So this specific series is focusing in on the workforce capacity. Danielle, can you advance the slide, please?
Sure.
Great, thank you. And so you'll see that the different sessions for this learning collaborative really align with those different core competencies. So the previous sessions that were offered in February were really focusing in on humanizing your enabling services data. Today we'll be talking about fostering a healthcare workforce able to address current and emerging needs, and we'll talk a little bit about those objectives in a moment. And then in April we'll talk about reducing healthcare disparities through community partnerships, and then in May, June, equitable preparedness for vulnerable populations. So we do hope that you'll be able to participate in those as well. If you do want to participate in all of those, you'll need to register for each individual session. Next slide, please. Great, thank you. And so just for those of you who weren't at the last session, just a little bit of information about these learning collaboratives. They are tailored for health centers, primary care associations, and health center control networks. And so if you are working from a different type of institution like a hospital, you might find that some of this information might not be relevant to some of your practices, but overall, I think that you will find this information helpful. Each session is 90 minutes, and so there's 60 minutes of educational content followed by 30 minutes of office hours where we'll be here to provide some coaching or to answer any specific questions that you might have related to the work that you're doing and the topic that we're presenting on. And as I mentioned, you'll just need to register for future sessions if you want to participate in all of those. And again, the recordings are always going to be available to you. So if you missed those last 2 sessions, you can access those on the SDOH Academy website. And if you can't attend the next one, be sure you're able to look at that or view that through the website as well. Next slide, please. So the Social Determinants of Health Academy faculty is made up of 16 different organizations. We all really work together to increase access to care and improve quality of life for underserved populations and communities. You can go to the SDOH Academy website to get more information about the Academy partners. We're all available to provide specific training and technical assistance, so please know that we're here to support you and feel free to reach out whenever you need us. Next slide. So with that said, I'd like to introduce you to today's faculty. That's me over to the right. I am the Director of Learning and Curriculum Design at the Association of Clinicians for the Underserved. We also have Colleen Velez and Kai Lambert, and I'm going to ask them to introduce themselves. Kai, why don't you start off?
Thanks so much, Sabrina. Hi, everyone. My name is Kai Lambert, and my pronouns are he, him, and his.
I am the program manager for the National LGBT Health Education Center, which is the division of the Fenway Institute, which is part of Fenway Health and FQHC in Boston, Massachusetts.
Great, thank you.
Hi, everybody. Oh, sure. Hi, everybody. My name is Colleen Velez. I am the Associate Director of Federal Technical Assistance at Corporation for Supportive Housing, or CSH as we're known. We are a national nonprofit organization working to develop supportive housing across the country. And as an NCA partner, we particularly focus on homeless subpopulations and making health and housing partnerships between FQHCs and housing resources within communities.
Great, thank you, Colleen. Next slide, please. So for today's learning objectives, we really want to focus in on the first two that you see on your screen that have a little orange box around them. When it comes to the workforce and addressing social determinants of health, there's just really so much territory that we could cover, and we really had to narrow down our focus. So for this and the next session, we'll be talking about community health workers and LGBTQIA cultural competence in the healthcare setting. Kai will kick us off by discussing why we need to put more energy into our LGBTQIA cultural competence and strategies that we can take to recruit, train, and retain staff who are able to serve the LGBTQ community. And then Colleen will talk about the role of community health workers in addressing social determinants of health for low-income and homeless populations. I do want to direct your attention to two handouts that you can download. One is a summary of evidence of the effectiveness of community health workers. It's a great handout if you're looking to make the case for hiring community health workers at your organization. I particularly like the ROI data on the second page. And then the second handout supports the educational content that Kay will deliver on providing recruitment, training, and retention for the LGBTQ proficient providers. Next slide, please. And so just one last reminder, please don't rush off at the end of the hour. We rely on session evaluations not only for quality improvement, but also for reporting purposes. And as you know, reporting and funding go hand in hand. So help us out by completing a session evaluation. And then we also encourage you to stay for the office hours so that we can chat a little bit about what's going on at your health center. Next slide, please. And with that, I'd like to have Kay Lambert kick us off with the educational content of this session.
Fantastic. Thanks so much, Sabrina. We can advance to the next slide. Super. So today I'm going to be talking about recruiting, retaining, training, and supporting LGBTQIA+ providers and also patients via providers who are literate in this competency. Just briefly for anyone who's not familiar with the acronym, when I use the acronym LGBTQIA, I'm referring to lesbian, gay, bisexual, transgender, queer, intersex, asexual, and other sexual and gender minority people. And why the focus on this competency? So there's a few different reasons. One of the reasons is that sexual and gender minority people are increasingly accessing healthcare, particularly at community health centers. We see that for sexual and gender minority folks, a lot of the time people are either lower socioeconomic status, and also, interestingly, that many sexual and gender minority people have reported feeling better supported in larger community health centers. So that's why they may be seeking care there. In the past, sexual and gender minority people have struggled to meet their needs at any health center. And so a lot of people have that history and also still struggle to meet their needs in terms of competent care. And so this is a current issue. This is something that we need to be addressing. At Fenway Health, we see a lot of our patients who are traveling from far out of state. And even if they are in state, they are traveling into Boston from the suburbs and from further away to receive their care. And our vision at Fenway is that anybody should be able to walk into any health center and be treated with competency, courtesy, and understanding regardless of their identity. It's also important to have a comprehensive strategy for training, recruiting, and retaining staff who are able to serve sexual and gender minority patients. This isn't something that people are necessarily going to just be able to do without support. When you think about minority populations, when you think about populations that have been historically marginalized and stigmatized, part of that narrative is that those individuals have been erased from our education system. And so for a lot of clinical providers, for caseworkers, for any individuals, they may not have been exposed to what it means to care for sexual and gender minority people in a healthcare setting within the context of their education. And so I'm going to talk a little bit about ways in which you can find folks who are going to be a good fit in terms of providing this care, how you can help educate those individuals on how to do this well, how you can support people who they themselves as providers identify as sexual or gender minorities, and how then all of that system works together across the board of the health center. Next slide. Beginning with recruitment, starting right at the very beginning. So if you're looking for a new provider and you know that one of your healthcare center's objectives is to seek employees who are LGBTQ culturally competent or who desire to learn about the community and have the willingness to provide this care, it's important to look at job postings and advertising. Inside your job posting, are you using affirming language? Are you stating very directly that at your health center you prioritize sexual and gender minority health and that you're looking for providers who are interested in same? And also, it can be very compelling for people who are seeking to work in a healthcare environment that supports the LGBTQ population by putting your equal opportunity statement, which has language which protects gender identity, gender expression, and sexual orientation. I've talked to a lot of staff who intentionally sought out work with sexual and gender minority populations. And when they were looking at the job postings for Fenway Health, they said something that they immediately did is they actually scrolled through the job listing. They didn't even read what the responsibilities were, but first they went down to see if we had an inclusion statement that included protections for gender identity, gender expression, sexual orientation, race, religion, all of these different pieces, because the individuals that we're seeking to recruit are looking for that kind of inclusivity. Also looking at your recruitment sources. So existing platforms aren't necessarily as welcoming to the LGBTQ community as some others. Here on your screen, you'll see that there are 4 existing platforms that I recommend. One is OutProNet. That's for people who are already professionals who are seeking jobs. So these are usually individuals who self-identify as sexual and gender minorities and who want to either post or get recruited for jobs that are affirming of the community. Also, Campus Pride does surveys of colleges, universities, and graduate schools across the country, and then rates them for their inclusivity for the LGBTQ community, and they have a job posting board that's really robust. So does the HRC. The Human Rights Commission, they have a job posting board for recruitment, and they also have a rating system for businesses that gauge those businesses based on their inclusivity practices. And then glma.org also has a job posting board. For interviews and hiring, when you're talking to potential candidates, candidates should express an understanding of and also a desire to serve the LGBTQ community and other marginalized groups. So this should be something that comes up in the interview, either prompted by you as the hirer or by the person themselves. And it should be something that's prominent in how this person wants to go about doing their work. It's also important to remember that a candidate may not have experience serving this community, the sexual and gender minority community explicitly, but they should have a strong desire to learn to do so. So it's not necessarily a prerequisite that they work for a health center that specializes in this, but they need to have a strong desire to learn. And then also talking to people about whether an employee, figure out with your other managers, with other staff, with other people who are going to be working with this potential employee, gauge how that employee is learning and make the expectations for those gauges clear in the interview. So for example, at Fenway, we have an expectation that any clinical provider is going to attend a once weekly meeting for the care of transgender people. We talk about cases during this meeting, we discuss different issues. And so for any new provider coming into Fenway, it's going to be an expectation, and we're going to gauge their learning based on their participation in those meetings. And so that expectation should be made clear in the interview section. And then you can talk with the person about whether or not that means that the job would be a good fit for them. Next slide. Talking about training. So you've recruited somebody, you decided to hire that person, now what? And also you have an existing workforce. So people on your existing workforce, perhaps as a healthcare institution, you didn't prioritize LGBTQ healthcare as something that you were looking for when you hired a whole bunch of people. So there's a lot of reasons why you're going to need to look at training as a way to develop this workforce. So the best thing that you can do is to make professional development opportunities available. Make sure that providers are given support and resources to pursue their further learning for the needs of sexual and gender minority patients. And not just providers, but also community health workers, frontline healthcare staff, administrative staff, people who are on the back end. We have folks who work in our billing department, and they're expected and given time and resources to take advantage of professional development opportunities with regards to increasing their knowledge around sexual and gender minority health. So throughout the healthcare system, making sure that everyone is given the same opportunities to increase their knowledge. Also, identify who on your staff is an LGBTQIA champion and help support that person in educating and training staff. And what that means is that that individual, if they're really gung-ho to do this work, that's fantastic, but that person needs to be given time, space, and compensation for doing any sort of training and doing any sort of mentoring for other people. One of the things that we often see is that somebody steps forward and says, I'm really passionate about doing this. I really want to help our clinic move forward and improve in this. But that individual's time, they're basically expected to do all of that work in their free time. And it actually is quite a bit of work. And so as a healthcare institution, one of the best things that you can do is if somebody makes themselves known as a champion to say, okay, we're going to make sure that you have this many hours per week blocked from your schedule to do that work, or we're going to provide separate compensation and hire you on as a consultant to do that specific work, something that acknowledges that that work takes a lot of time. Next slide. In addition to providing training and professional development, mentorship is one of the best possible ways for people to learn. So for all new hires at Fenway Health, we make sure that they're connected to their medical floor lead, or depending on where they are in the institution, maybe at the front desk or something else, that they are introduced to somebody who has a little bit of seniority and can help them to understand this is how we do things at Fenway, this is why we do things at Fenway. And oftentimes people will make themselves known as potential mentors. They'll say, I'm really passionate about doing this. We have one nurse in particular, for example, who really, really cares about mentoring our incoming nurses in terms of their competency for sexual and gender minority people. And so for that individual, we make sure that she has the time to coach these folks, to help mentor them, to help them work through challenges that they may be having. Mentorship can also be available from outside agencies. One model for group-based mentorship is the ECHO virtual learning model, which some of you may be familiar with. At the National LGBT Health Education Center, we have several ECHO programs, one of which is focused on transgender and gender diverse healthcare issues, and we run 2 of those concurrently throughout the year. We'll probably be starting our next one in late summer, so you can always check out our website to see when those are opening up. And that's a way, if you don't have somebody in your staff or on your staff who has the time or the interest in doing this mentorship, you can definitely get it from outside sources, and we're happy to help provide that if needed. It's also really critical to provide training for all staff. So in order to provide excellent care for anybody, including sexual and gender minority folks, means that all staff at the health center need to receive training. So that's administrators, that's front desk staff, clinicians, board members, executives. I did a whole series of work with a hospital system nearby, and we trained everyone. We trained all of the clinicians, administrators. We trained the staff who brought meals to patients. We trained the staff who took out the garbage. We trained the staff who did disinfecting of the rooms. We trained everyone. And the reason is anybody who's working in a healthcare system may have a potential interaction with patients. And even if that individual doesn't have regular interactions with patients, that person may be making decisions that affect the health of patients. And so all of these individuals should be provided with basic LGBTQIA concepts and understanding of sexual and gender minority health disparities, and how to work with these individuals in the context of their own workflow and jobs asked. Next slide. So once you've got these folks hired and once you have them trained, how do you hold on to these people who are excellent providers? So we produced a publication last year called Recruiting, Training, and Retaining LGBTQ Proficient Clinical Providers, a workforce development toolkit. It's available on your sidebar in the handouts for you to download. And what we found in a recent survey by the Human Rights Campaign was that about 20% of people who identified themselves as sexual and gender minorities in the workplace had searched for a different job than the one they had because they didn't find that their employer was welcoming and accepting. And 25%, so a quarter of people who responded to that survey who identified as sexual and gender minorities said that they stayed in a job primarily because the environment was accepting of their identity as an LGBTQ person. So it can be a really powerful retention tool to be an affirming and welcoming workplace. It's really critical for leadership to set the tone for the health center. So starting at the top and making it clear through your diversity and inclusion statement, your non-discrimination statements, your hiring practices, and everything that starts with that leadership component, communicating that your health center is interested in caring for sexual and gender minority people. And not only should patients who are sexual and gender minorities feel welcome and supported at the clinic, the staff should also feel very supported by written policies. That includes insurance, that includes those non-discrimination statements. And all of this works as a large system. So any patient who's being seen at your health center, if they find out that even though they're receiving excellent care as an LGBTQ person, that their provider who also identifies as a sexual or gender minority is not being taken care of by the health center, we've seen that that really affects whether or not that patient is going to stay in care with you. Next slide. Other preparations that you can make in order to create a welcoming and inclusive environment for LGBTQ providers and patients is create family and medical leave policies that are inclusive. So not naming gender in terms of who gets time off to take care of children. Also creating policies that are inclusive of families with all kinds of different structures. Making sure that employee health insurance programs cover gender affirming care. Many times work-provided insurances and private insurances, especially if they are self-pay, have specific exclusions for covering gender affirming care. So this might exclude hormones, this might exclude surgeries for people who are transgender and gender diverse, and making sure that your employee health insurance covers that gender affirming care can send the right message, not only to people that you're looking to recruit who are affirming and welcoming of sexual and gender minority people, but also for patients who are coming to your clinic. You can encourage the creation of an LGBTQIA employee affinity group or a community resource group. There's a lot of different words for this sort of organization. On our website, which is the LGBT Health Education Center.org, you'll see that listed at the end here. You can find an entire webinar series devoted to how to create a community advisory board or an employee affinity group within your organization focused on sexual and gender minority health. Also partnering with local organizations and also celebrating sexual and gender minority holidays and community. So can you partner with the folks who are putting on your local Pride Parade and say, hey, we'd like to have a booth, we'd like to hand out information about our health clinic and what we do for sexual and gender minority people at the Pride Parade? Can you put up advertising inside your health center and say there is a support group that's right down the street at this local community center, just making it really visible and really apparent that you are affirming of sexual and gender minority people. And also acknowledge that marginalizing social structures might have made it so that sexual and gender minority candidates for a job are at a disadvantage. This might look like people who don't necessarily have the educational background that you might see for some other more advantaged candidates. It might look like somebody who has had a work history where they aren't staying in a job for very long. If you think back to the statistic that I talked about from the Human Rights Campaign in terms of what helps people feel like they can stay in their job, it makes sense that somebody who is a sexual or gender minority individual may have had to leave their workplace multiple times for fear of discrimination or to escape existing discrimination. And so talking with people through their resume, talking with people through their lived experience, rather than just throwing those resumes out as soon as you see them if they don't meet your expectations. Next slide. So pretty much everything that I talked about in these slides is covered in that publication that I talked about that's available for download in your handout section over on the right-hand side of your screen. It's also available, this is our website, lgbthealtheducation.org. In addition to this publication, we have many, many other publications that cover everything from how to work with people who have opioid use disorders and identify as sexual or gender minorities, to creating a transgender health program inside your clinic, and much, much more. We also have a very large library of recorded webinars, trainings, and toolkits, most of which are available for continuing medical education credit. So I would encourage you to take advantage of that resource. If you think back to some of those earlier slides about training, one of the things that we do all day, every day, is to provide training to health centers across the country. And so we're happy to help do that for you all as well. Next slide. So at this time, I'll take some questions about that content and then hand it over to Colleen.
Thank you, Kay. And I just want to ask participants to please enter your questions in the chat room. Okay, so it looks like we don't have any questions at this time. So Colleen, let's hand it over to you.
Thank you. Next slide. Okay. So what I'm going to be focusing on today when we're talking about fostering a healthcare workforce that's able to address SDOH is talking about community health worker and community health worker programs, but even more than that, having community health workers that have lived expertise or lived experience in homelessness into those teams. We all know that when we're talking about social determinants of health, that one of the determinants that has one of the largest impacts on health outcomes is housing. So having a workforce that understands the population of those that are homeless, those that are housing unstable is very important. And then even more than important, if you have community health workers and community health worker programs, to be able to have people as part of those teams that have experience and understand those systems is truly important in addressing healthcare and health outcomes for those coming to your doors or those that you're outreaching to. Excuse me. Next slide. So just a little bit about CSH. I talked about it in my introduction. So CSH is a national nonprofit organization focused on the development of supportive housing, affordable housing with services to serve those that are most vulnerable in our community. As an NCA partner and our first grantee, our focus has been particularly around addressing healthcare needs and health outcomes for those that are homeless, and in particular, making health and housing partnerships. We do this through training and education. CSH is a lender and has a lending arm, and we help develop projects across the country. We work on policy reform, and then we do also have consulting and technical assistance across the country, and then obviously in particular with the HRSA work that we do. Next slide. So in a way to have a workforce that can help address SDOH and help address housing instability or housing issues is to have a workforce that understands who is homeless, who is housing unstable in their community that they are serving. So there is places that people can go that understand where that information is and who has those needs within the community, both on the homeless system side and the healthcare side. So there's a lot of data sources out there that health centers that can look into to figure out who is homeless or who is housing unstable within our community. Through the homeless system, there's a homeless point in time count. There may be some of your health centers on the line right now that participate in that. It is a point in time where they go out and try to estimate and count all homelessness within the community, but all that data is available both locally and nationally. There's the annual homeless assistance report, again, both national and local reports that you can find out the information for your particular community, and housing inventory. So homeless systems within each community have an inventory of all their housing resources that you can connect with. And then obviously on the healthcare side, there's the health conditions and services information, UDS, which you all have access to, and the community health needs assessments that is done locally. So understanding both who are the populations that are homeless and housing unstable, and then also what their healthcare needs are. Next slide. So we just kind of pulled some general information together when we're looking at what homelessness and health looks like. This is all taken from 2018 UDS data, and it's really looking at different subpopulations in comparison to overall populations and what the top 5 diagnoses are. Obviously, each population has some differences and some similarities, right? Universally, we are all, our top issue is overweight and obesity, but then it changes based on what kind of social determinants of health our patients may be dealing with, right? So for homeless patients, yes, overweight and obesity, but hypertension, depression, and other mood disorders, anxiety disorders, PTSD, tobacco use. And then some of these things are similar, and some of them move a little bit differently when we're talking about agricultural workers or those patients that access public housing or get health care through public housing. So it's really just trying to understand what patients are dealing with, what disorders that they do have, and then basically how housing and housing instability feeds into that. And then what can we do as a health center through the work care that we're providing and through our workforce and through our community health workers to help address these things. Next slide. So one of the things that I want to try to address is, like, what are the benefits, right, of having people with lived expertise in your community health workers programs and with community health worker positions, and having peers as part of that, right? One thing, and one of the most important things is that when you're trying to address SDOH and when you're trying to address housing instability and homelessness, if you have people in your community health workers that have that lived experience or lived expertise, they have an understanding of the systems that patients need to be connected to help resolve their housing issues. It is, it's something that they have been through. It's something that they have resources upon and know how to draw on what their experiences were within that system to be able to help patients currently that are experiencing homelessness or health instability. So it's a huge benefit in trying to address housing as an SDOH. But then it also just has benefits, again, both for the clients, for the peers, and for the community itself, right? So for clients, it really does reinforce the belief in resilience and recovery. There is, empathy for that client's experience. They have that understanding. They can provide support. They have an understanding how to potentially break down some barriers that patients may be experiencing because they can't access housing or have housing instability. It really helps to build self-sufficiency when you have those peers and those with this experience as community health workers. For the peers themselves or community health workers, right, it's skill building. It is their own helping and healing. It is building their skills and building their ability that maybe that they didn't have a long time in the workforce, but they're back in, and building their ability to grow and learn and develop and move forward and strive in their life. and it really is meaningful employment and earning power for them that maybe they haven't had up to this point. And for the health centers in the community, it really does help build rapport with providers. It provides a voice within the community. It provides health centers to have a voice within the homeless systems within their community. It really is that understanding of social determinants of health and what your community needs around housing and housing instability. You know, there's those connections to those community resources that once you have people as part of your community health workers that can really bring that knowledge to the team. And there's just a ton of workforce potential that can be tapped into that maybe previously would be looked over. But it is a piece of workforce potential for your health center within your community. Next slide. So the piece of the things around community health workers is that there are skills and there are qualities that are needed to be a community health worker. And a lot of times when we're talking about bringing people on that are peers or those with lived expertise, they may have some of them, but they may not have all of them, so that it gets overlooked. So there are things that inherently they bring to the table that community health workers generally may not have, as I touched on before, right? They have connections to the systems. They may be able to break down barriers. They have cultural competencies when dealing with people that are homeless or have housing instability. They have compassion and creativity, right? And that empathy. But a lot of times, because the skills piece on the left is maybe not so evident, they are overlooked. But I think when you bring it back down to the core and what you're looking for community health workers to do for your health center and for really trying to address SDOH and working with those that are homeless and are housing unstable, skills can be learned. The qualities are there. So, I think Kay brought that up earlier. I mean, we shouldn't be overlooking the skills that the peers and those with lived expertise can have as part of community health worker programs, because we don't automatically see the skills that we're naturally trying to look for right away. There's that workforce potential. Again, there's mentoring. Those skills can be developed. And maybe because the education isn't there right off the bat, that doesn't mean that there isn't learning and education that can continue, that can happen while they're part of the community health worker program, and that the qualities that they do bring are really a true benefit for your health center at the end of the day. Next slide. So here, the next couple of slides, I'm just kind of going to talk through kind of the roles for peers and those with lived expertise in community health workers. So just understanding that, they can take community health workers and the peers and those with lived expertise that are community health workers can take on a variety of roles within the organization. But just because they can do it, that doesn't necessarily that they should. Right. So I think a key is setting the scope of community health workers' profession and performing to the breadth of that profession. Right. So I'm sure that you may have community health worker programs that everybody could do everything, but really designing a program, and especially in a program that incorporates peers and those with lived expertise, that really brings forth some structure and some key roles that they should be performing in their jobs will be the biggest benefit. So every profession within your organization, has a defined scope of work, and it's important that all the professionals that are working for you within the organization understand what that scope of work is and utilize that in their job roles every day. So it is very important that as a health center, you provide that for your community health workers. When everyone, including health workers, works within their scope, the clients and the communities are served to the best of the organization's abilities. Again, there's a lot of different things that can happen, and just because all these things that can happen, it's not something that just should be blanketedly placed on your community health workers, right? That we really should have a scope that defines what the skills and the qualities that they have, and defines the needs of your communities and what you need out of them as a health center. And while community health workers may not be able to solve all the challenges related to organizational issues on their own, they do, like I said, have many of the skills and the qualities that are needed at their disposal to do the work. So when we talk about roles for peers and community health workers, there's, a myriad of them. And then depending on what your health center's needs are, what your community's needs are, what type of homelessness issues you have, or housing instabilities issues that you are finding that you need to address, your connection to those homelessness systems will help you define and scope out what your community health workers should be doing at the end of the day. So some of these things are things like outreach, right? Recruiting of the individuals, informing of the health center's services, bringing them into the doors if they're not able to get there, things like that, right? Representing your organization at community events, and having those pieces for your health center. Obviously advocating, identifying the community needs and resources, advocating for the patients and the clients within the community, and empowering communities to pursue their own desired policy change. Again, that connection of those with lived expertise that understands housing and homelessness systems really can help bring about a voice, the health center voice within that system, and also the patient's voice within that system. There's coaching and social support, motivating people to access their care and get the services that they need, supporting behavioral changes, and facilitating community-based supporting groups if people can't get into the doors. It's a lot of times people that are homeless, that are housing unstable, need that support around them to even access care and the care that they need, or make those connections to the care that they need, or the health workers themselves can be that support within the community for those that can't make it within the doors. They can have a role in screening and referrals. They can do information collection. They can have individual and do community assessments for SDOH. And they can be resource links and referrals, and provide referrals for patients within the community. Next slide. And again, there's things like cultural mediation, right? How to use the health and social service systems, being that educator and how to access the things that they need to access, not only for their health, but for their housing situation. Culturally appropriate health education, right? Health promotion, disease prevention, health conditions management that is culturally and linguistically appropriate. And not only that, is trauma informed, right? Many people that are homeless or that are housing unstable have suffered a lot of trauma, and having peers and those with lived expertise doing that work as part of your community health worker can do it in a trauma-informed way. They will understand not over asking questions or asking the same questions every single time they interact with people, right? Understanding that there is trauma with this population, and be able to work with them in that trauma-informed way and cultural appropriate way. Community health workers, can be a part of care coordination and case management and system navigation, providing assistance and coordination with your social work staff, with other non-clinical staff for homeless patients, making referrals and being able to help provide follow-up and helping to address barriers to services and care system navigation. Again, both not only with the healthcare system, but with the housing system and the homeless system. They can help with evaluation and doing data collection and assisting in interpreting results of the data for your health center and sharing those results and findings, and both for the health center itself, but within the community. And then again, finally, building capacity, to address issues, right? Building individual and the community's capacity to be able to deal with housing as an SDOH, and also being the next level of training, doing with the community health workers and training new peers and bringing more people on to build that program and have that connectivity through both your health center and the community. Next slide. So I will stop briefly with all of that and take any questions if they've come in.
And if you have any questions, please use the chat function, and Danielle will send them over to us. Okay, so it looks like we don't have any questions yet. So Danielle, can you take us to the next slide, please? So thank you so much, Kay and Colleen, for sharing your insight on community health workers and having more affirming, more culturally competent workplaces for the LGBTQ community. I also want to direct your attention to another resource. That's the STAR 2 Center, the Solutions Training and Assistance for Recruitment and Retention is what STAR stands for. This is a resource center for health centers, primary care associations, health center control networks who are looking for tools and resources to support their recruitment and retention needs. And so I encourage you to go there to access everything from a self-assessment to a turnover tool to a financial impact tool related to turnover to help you with some of your more general training, your general recruitment intention efforts so that you can be building that strong workforce. Next slide, please. And so just a teaser for our next session. This session today was really intended to provide an overview. And so we're just talking about, the role of the community health worker and then some of those initial steps that you can be taking to have a more culturally competent, affirming staff member to support your LGBTQ community. Next week, what we'll plan on doing is talking more about recruitment, retention, training strategies for community health workers. This is going to be a really interesting conversation because we're really talking about employing staff who oftentimes are still living with some of the circumstances that led them to become homeless or to be part of the recovery community. So really engaging that lived experience or lived expertise, as Colleen states, as part of this work and how that can be of value. And then Kay will also talk about ways to be cultivating buy-in for workplace improvement in the service of caring for sexual and gender minority patients. Also very important work if we're going to be making some of those changes at the policy level or engaging in community partnerships like Kay talked about earlier. So I hope you'll participate in that session. You do need to register separately to participate in session, but we'll be doing more of a deep dive for those as opposed to the general overview like we did today. Next slide. So again, that next session is March 25th. It's at 2 o'clock Eastern, and it will also include 30-minute office hours. And you can register at the SDOH Academy site at sdohacademy.com/collaborative. Next slide, please. And again, this is a reminder to complete the brief webinar evaluation before we end the educational content of this session. We will have the office hours right after this, where we'll answer some of the questions that are coming in. But if you are leaving, please go ahead and complete that evaluation, or even if you're staying for office hours, you can go ahead and complete that as well. And it will also be emailed to you through WebEx. Next slide, please. Here is all of our contact information. Everybody is definitely very welcome to reach out to us with any specific questions that you have. I know sometimes even during office hours, there are questions that you might have but might not feel comfortable sharing in a public setting. That's perfectly fine. If you want to reach out to any of us individually, we're happy to help talk through some of those issues that you might be experiencing. Next slide. Great. So just more information about the social determinants of health academies. And then if you'll go to the next slide, we can go ahead and start our office hour sessions. Again, I've got our information up here just so you know who you're talking to. If anybody, I do have a few questions that we have received that I want to go ahead and answer as we kick off our office hours, but I encourage you to go ahead and use your chat to start asking some of these questions. And I believe Danielle is going to be unmuting your microphone. And so once she does that, if you want to self-mute yourself or self-mute just to prevent any background noise that might be in your own office environment, that would be really helpful for others who might get distracted by that noise. So I am going to ask some of the questions that are coming in right now. And I think this one is going to go to Colleen. So Colleen, the question is, our organization would very much like to have a CHW program. What are some ideas on how to generate funding to cover these positions?
Oh, well, that's a big question. So I think one, if you download the resource that Sabrina attached, it has some information on how you make the case for trying to get that funding for your health center. The other piece, and I know this is something that started already, but CSH and National Healthcare for the Homeless and in MHP Salute have been running a community health worker program, learning collaborative, and have an MHP Salute in particular, and I don't have any of the stuff at my fingertips right now, which is kind of my bad, I'm sorry, but has a myriad of resources on how you can develop community health worker programs and some of the funding sources that are available to do that. So I would, for now, again, because I just don't have anything at my fingertips right now, direct you to MHP Salute's website and going and searching their community health worker program information that they have, because they do a lot of training and have been working with health centers across the country to develop community health worker programs, and have information there on funding sources and where you can look for and ask for funding for community health workers.
Great, thank you, Colleen. And being that this is a learning collaborative, I think it's an excellent opportunity for us to be learning from each other, so everybody who's on the line. If there are folks on the line who have come up with really innovative ways to fund their community health worker programs, I'd love to hear that. So feel free to chime in. I think everybody is, you can unmute yourself if you'd like to chime in and share some ways that you're funding community health workers at your organization.
This is Kay, just chiming in before other folks get going, but I wanted to just make a comment about how Fenway is addressed, making sure that we have community health workers as well, because we really recognized that it was very important. And for a long time, Fenway Health didn't do a very good job of incorporating community health workers into our main clinic. And so what we've actually done is we've partnered and actually have made part of Fenway Health an organization called AIDS Action Committee. AIDS Action Committee was founded at a similar time to Fenway Health, and they were much more about that community focus. And a lot of what they did at the time that they were founded in the very late 70s and early 80s is they went and sent individuals who volunteered their time to spend time with individuals who were dying from AIDS, whose families had rejected them, and where in many cases healthcare workers wouldn't spend time in the room with those individuals. And so they provided a lot of compassion care for those people. And since then, AIDS Action has really expanded to be a profound organization in terms of doing community outreach. They work with people who have substance use disorders. They work with individuals who are HIV positive. They work with individuals who are at high risk for contracting HIV. They also work with a lot of sexual and gender minority patients. And so their scope has expanded a lot. But what we see is that AIDS Action feels much more comfortable for a lot of individuals. There's much crossover for people who are sexual and gender minority folks and folks who have experienced or who are experiencing homelessness, per what Colleen was saying. And so for a lot of our patients who are currently homeless, AIDS Action, it just feels a little bit more welcoming, a little bit more tenable. And the way that we deal with the funding there is AIDS Action is actually its own separate NGO, its own funded entity. They apply for all of their own government grants, and then they apply for those grants with letters of support from Fenway Health stating that AIDS Action basically functions as our community health outreach program, and that it's very critical for helping to make it so that the most underserved and vulnerable populations are able to receive care, and that AIDS Action functions as a bridge between those communities and getting them into care at Fenway Health, and bridging from Fenway Health then to our partner hospital, which is Beth Israel Deaconess Medical Center. And a lot of the time when granting institutions see that bridging is happening to care, they know that somebody who is able to get a helping hand as they move through a healthcare system is much more likely to receive both preventative care and also timely care for a condition that they have, which saves them money. So that's sort of a long-winded way of saying that we have a separate organization, but we really try to make it clear that funding that organization is critical to helping those special and vulnerable populations.
Great, thank you, Kate. And that's really important to know. And I think, just working with health centers over the last 15 years, especially as we've been seeing so many changes in how services are being reimbursed. Right now, a lot of health centers are really working closely with their payers to make the case for how community health workers are really not only improving health outcomes, reducing hospital readmissions, but resulting in a return on investment. So again, just going back to that one pager, that's really helpful for having those conversations with your payers if your health center has the opportunity to take advantage of some new flexible payment models. I'd love to hear from some others who are participating. If you want to unmute your line and talk a little bit about how you're able to support community health workers at your organization, we'd love to hear that. And you're also able to use the chat room as well if you're uncomfortable speaking over the microphone. Well, while people are doing that, I have a couple of other questions that I thought I might ask, just based on some of the content that Kay and Colleen were sharing. So Kay had mentioned a few different strategies that your organization can take to be more culturally competent and more affirming. That might include posting on specific websites, developing more inclusive policies, including selecting a health insurance company that covers gender affirming care, creating employee affinity groups, partnering with groups that celebrate the LGBT community. And I was wondering if there were anybody on the line whose organizations have attempted to do some of this work or implement some of these strategies, and you know, what were some of the challenges and successes that you faced? And again, you can just unmute your line if you'd like to talk, or you can use the chat room. Okay, well, hearing nothing, I also want to, you know, ask Colleen, or just based on what Colleen was saying in her session, that community health workers can lead to improvements in how care is delivered, that can lead to better health outcomes. And there are specific roles that your community health workers can take in a health center setting, including outreach, advocacy, coaching and social support, screenings and referrals. I'd love to hear from folks on the line. What have your organizations done to support community health workers in taking on some of these roles? So has your organization conducted, or has your organization supported community health workers in their outreach efforts and in their advocacy efforts? And if so, how did they go about doing that? Does anybody have any strategies that they'd like to share that has helped their community health workers feel more empowered in their outreach work or in their advocacy work or in providing social support? And I'm seeing from some of the chat room that we do have folks online who are working closely with community health workers for specific populations. So I'd love to hear some of the support and training that you're providing to your community health workers to help them feel empowered in the work that they're doing. And if you're unable to unmute your microphone, please let us know in the chat, because we really do want to hear from you. So we have a comment in our chat that says that she worked as a community health worker and came from a background of health education and work with social workers and nurses on a community care team. They work on those who have high-risk, high-cost individuals on Medicaid, mostly offering coaching, social support. Many deal with housing, food, transportation, disability issues, and she works alongside her peers and feels treated as an equal. I think that's fantastic, and I'm sorry if the microphones aren't, able to be unmuted right now, but I'd love to hear more about what it is that your peers did that helped you feel more as an equal. And that's from Ellen Randall, one of our participants. Thank you for that. So we received another comment that says that from Reverend Shirley Brown that they have quarterly in-service with community health workers, and annually they have a community health worker conference to empower and equip them further in their tasks. That's great to have that development opportunity that they can participate in alongside others who are doing that same work. I think that's wonderful, and I can only imagine that that is very energizing. What about others?
I think that can you hear me?
Yes.
Oh, we can hear somebody.
Yay! Yay! My name is Susie, and I'm at Crescent Community Health Center in Dubuque, Iowa. And I work, we have a little project at our community health center, the Pacific Islander Health Project, where I work closely with a community health worker who's from the specific population we work with. We have a large Marshallese population in Dubuque, and my co-worker in the community health worker is from the Marshall Islands. So I would not be able to do anything without her. Not only the language barrier.
And how have you seen your practice or care team model change with her as part of your team?
We've really had to adapt some communication styles, just because translating ideas doesn't always happen the smoothest. Some of the other things, there's a large Marshallese population in Arkansas. She has went down to the University of Arkansas and has gotten training. And now that she's been doing this for a while, the community really, really looks to her for all their medical needs.
Great.
I couldn't do my job without her, so.
Right. Thank you so much for sharing that. I'd love to hear from others. How are others supporting your community health workers? You should be able to just unmute your microphone. What about those of you who are using community health workers in your advocacy efforts? Love to hear from participants about the role that community health workers play in advocacy and sharing their stories and talking to legislators about the work of community health centers and the role that community health workers play. Okay, well, I'm going to go on to another question. While I'm asking these questions, please feel free to be thinking of some of the things that you'd like to integrate into your program and any questions that you have for Kay or Colleen related to community health workers or cultural competency. But one of the things that I wanted to ask our group that I think was a great thing that Kay brought up was the use of mentorship programs to strengthen your capacity of the workforce and really serving and accommodating the specific and unique needs of patients who are impacted by social determinants of health. Is there anybody on the line who has a really good mentorship program that you're using to improve the capacity of your workforce in these areas? We've got a couple of comments in the chat. One from Sherry Lester. We work together, each giving their own input and gathering resources. We work as a team. We learn from one another. Absolutely, just really leveraging the skill sets and expertise that everybody brings to each other. And then from Reverend Shirley Brown, we have a diverse group of CHWs, mostly Hispanic and Creole speaking, to assist people living at home with chronic illnesses, which are mostly from this population. Also, all trainings are webinar-based and all trainings are webinar-based and facilitated trainings, and they're made available for free, which is a really great way to increase access to those learning opportunities. So thank you. Are there any other questions or challenges that anybody from this group is experiencing that they might want to ask our presenters today? We'll give it a few seconds for people to enter any information or any questions into the chat room, but if you're able to unmute yourself, please do that and chime in as well. Okay, well, it looks like there aren't any other questions coming in. I do want to encourage all of you to reach out to us individually if you do have any lingering thoughts or questions that we can help you with. We're always happy to help and provide support. Our email addresses are in the slides, so we're always happy to answer and field questions. And Danielle, if you could just go on to the next slide, I think we'll go ahead and wrap up. So just want to say thank you. Don't forget to participate in our next session on March 25th, where we'll take a deeper dive into some specific retention, recruitment, training strategies for community health workers, and then specific ways that we can be building buy-in within our organizations to be doing more affirming work for our LGBTQ staff and patients. Next slide, please. All right, that is the end of our show. Thank you so much for everybody who participated. Please be sure to fill out the evaluation and join us in a couple of weeks. Thank you, and thank you to our presenters, Kay and Colleen. Thank you.
Thank you, guys.
Thank you so much, Sabrina. Thanks, everyone.
Bye, everyone.
Bye.